Bismillah ar-Rahman ar-Rahim. This is the second lecture of thyroid cancer. Now I will talk about symptoms and signs of thyroid cancer. Most thyroid cancer don't cause any signs or symptoms early in the disease. As thyroid cancer grows, it may cause a lump or nodule that can be felt through the skin on patient neck. A feeling that close-fitting shirt colors are becoming too tight, as we see here. Changes to the patient voice, including increasing hoarseness, difficulty swallowing and breathing, the swollen lymph nodes in the patient neck, pain in the patient neck and throat. Now I will talk about diagnosis of thyroid cancer. We will begin with physical exam and blood tests for levels of FT3, FT4, TSH, calcitonin, calcium, CEA or carcinoembryonic antigen, complete blood count. Fine needle aspiration cytology with ultrasound technology to guide biopsy of thyroid nodule and neck nodes. Now I will talk about imaging scans for diagnosis of thyroid cancer. Radioiodine scan. This test can detect thyroid cancer and determine if cancer has spread. We are seeing here thyroid cancer spread beyond thyroid gland. We are seeing here thyroid cancer spread to other parts of the body. We are seeing here CT scan for anaplastic thyroid carcinoma. We are seeing here positron emission tomography or PET scans can detect thyroid cancer and cancer spread. Now I will talk about complications of thyroid cancer. Thyroid cancer can spread or metastasis to other parts of the body such as liver, lungs, bone, brain, etc. Detecting and treating thyroid cancer in the early stages reduces the risk for metastasis. We are seeing here in this slide brain metastasis, lymph node metastasis, and lung metastasis, liver metastasis, bone metastasis. Thyroid cancer recur or comeback even after treatment. Because thyroid cancer grows slowly, it could take up to 20 years to come back. Recurrence happens in up to 30% of thyroid cancer cases. We are seeing here recurrent thyroid cancer. Overall, thyroid cancer prognosis or survival rates or outlook is positive as we see in here. But it is important to know that after thyroid surgery or treatment, the patient body still needs thyroid hormones to function. Synthetic thyroid hormones such as levothyroxine take over for the thyroid hormones that the patient body no longer naturally produces. The question now, how does thyroid cancer affect pregnancy? Thyroid cancer is the second most common cancer diagnosed in people who are pregnant. Breast cancer is faced. Approximately 10% of thyroid cancers develop during pregnancy or within the first year after childbirth. Experts believe fluctuating hormone levels during pregnancy may trigger the cancer. If the patient receives a thyroid cancer diagnosis during pregnancy, the health care provider can discuss treatment options. We are seeing here pregnancy woman with thyroid cancer. Proven ways to navigate thyroid cancer in pregnancy. Depending on the cancer type and severity, the healthcare provider may recommend delaying treatment until after the patient delivers her baby. If treatment can't wait, most people can safely undergo surgery to remove the cancerous gland. The patient shouldn't have radioactive iodine diagnostic tests or treatments, as we see here, when her pregnant or breastfeeding. We are seeing here slide of thyroid cancer treatments. Treatment thyroid cancer with surgery, treatment with hormone therapy, chemotherapy, drug therapy, reactive iodine, radiotherapy. I will talk now about the treatment of thyroid cancer. It depends on the thyroid tumor size and whether the cancer has spread to other part of the body. Treatment include surgery. Surgery is the most common treatment for thyroid cancer, depending on the tumor's size and location of the tumor. The surgeon may remove part of thyroid gland, this called lobectomy, or all of the thyroid gland, this called thyroidectomy, and also removes any nearby lymph nodes where cancer cells have spread. The second method for treatment of thyroid cancer is radioiodine therapy. With the swallow a pill or liquid containing a higher dose of radioactive iodine than what's used in a diagnostic radioiodine scan. The radioiodine shrinks and destroys the diseased thyroid gland along with cancer cells. This treatment is very safe. The third method for treatment of thyroid cancer is radiation therapy. This consists of external radiation therapy and internal radiation therapy. Radiation therapy kills cancer cells and stop them from growing. External radiation therapy uses a machine to deliver strong beams of energy directly to the tumor site. But internal radiation therapy, or called brachytherapy, involves placing radioactive seeds in the tumor or around the tumor. The fourth method of treatment of thyroid cancer is chemotherapy. Intravenous or oral chemotherapy with sulfated drugs kill cells and stop cancer growth. Very few people diagnosed with thyroid cancer will ever need chemotherapy. The fifth method for treatment of thyroid cancer is hormone therapy. This treatment blocks the release of hormones that can use cancer to spread or come back. Now I will talk about the prognosis or survival rate of thyroid cancer. 8 out of 10 people who have thyroid cancer develop the papillary thyroid carcinoma type. Papillary thyroid cancer has a 5-year survival rate of almost 100% when the cancer is in their gland or localized tumor. Even when the cancer spreads or metastasis, the survival rate in this case is close to 80%. We are seeing here in this slide survival rates of thyroid cancer. When the tumor is in the thyroid gland only, the survival rate for papillary carcinoma 100%, for follicular carcinoma 100%, for medullary thyroid carcinoma 100%, for anaplastic thyroid cancer 31%. When the tumor is spread to regional area, the survival rates of thyroid cancer for papillary carcinoma is 99%, for follicular carcinoma 97%, for medullary 91%. The survival rate for anaplastic thyroid carcinoma is 10%. This rate means that on average year, about 80% is likely to live for at least 5 years after diagnosis as someone who doesn't have metastatic papillary thyroid cancer. In this slide, we are seeing here the survival rate for 5 years with a blue color, the survival rate for 15 years with a red color, the survival rate for 30 years with yellow color. Now, the survival rate for papillary thyroid carcinoma for 5 years 98%, for 15 years 97%, for 30 years 91%. The survival rate for follicular carcinoma for 5 years 96%, survival rate for 15 years is 95%. The survival rate for 30 years is 92%. The survival rate for medullary carcinoma of the thyroid gland for 5 years is 96%. For 15 years, 86%. For 30 years, the survival rate is 86%. I will talk now about survival rate for follicular thyroid carcinoma. Follicular thyroid carcinoma close to 100% for localized tumor. The survival rate for follicular thyroid carcinoma when the tumor is spread is around 63%. The survival rate for type of medullary thyroid carcinoma for 5 years close to 100% for localized tumor. For metastasis tumor, the survival rate for 5 years around 40%. Now, the survival rate for 5 years for anaplastic thyroid carcinoma close to 31% for localized anaplastic thyroid cancer. For metastasis anaplastic thyroid cancer, the survival rate for 5 years is around 4%. We are seeing here 5-year survival rates for localized tumor, 99.9%. For regional spread tumor, the survival rate for 5 years is 97.6%. For the survival rate for 5 years for distant metastasis is 54.7%. The survival rate for 5 years for unstaged tumor is 88.1%. In the end of this lecture, thank you for all.